much, Shruti. A very warm good evening to one and all present here, and a very happy 75th Independence Day. My name is Shivangi Dayal, Editorial Chief of Rotaract Club of DSPSR. Before starting with the webinar, I would like to acquaint you all about what stroke really is. A stroke occurs when the blood supply to part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. About every 2 seconds, someone suffers a stroke, and about every 5 seconds, someone dies from a stroke, regardless of age and gender. Talking about India, stroke is one of the leading causes of death and disability in the country. In regard of today's topic of the session, stroke, we welcome among us our esteemed guest of honor, Mr. Hardeep Sodhi. The next dignitary to honor us with his presence is Dr. Anand. Thank you so much to both of you for joining us and for giving us your time. Firstly, I would like to invite Mr. Hardeep Sodhi to take this session further. Please, sir, over to you.
Thank you very much, Shruti, for this wonderful introduction. Thank you, Shivangi, Shri, and all the esteemed members of DSPSR Rotaract Club, as well as the many other Rotaract Club members who are attending here for a very important topic that we are grateful for the opportunity that you have given us for. That is raising stroke awareness, because indeed everyone, including the man on the street, needs to be aware at least a little bit of what stroke is. Dr. Anand is very experienced doctor in the field. I'm very grateful he's also joined us, and I'm sure his inputs will be very useful to all the people present here. I would like to start with a small presentation. Can I share my screen? Can I go ahead and do that?
Yes, sir.
Okay. Okay, some aspects, Shruti, you have very well covered, so I will not be focusing much on them. Broadly, this is about Stroke Support India. We are a patient support group with a mission of raising stroke awareness and supporting stroke survivors and their families. In fact, we are one of the few recognized by the World Stroke Organization as well as a leading stroke group. We are an NGO established in 2013. These are the fields that we work in, and Stroke Support India is an effort of this NGO. As you mentioned, we have a WhatsApp group almost nearing capacity. We have a Telegram group, which is almost global. We have people from UK, Nigeria, Iraq, Iran, etc. also joining in those groups. And anyone who is interested, these are the ways that they can join us group. These are our contact coordinates. I'll move to the next slide. You have generally speaking covered this. My mother suffered a stroke in 2006, and this is at that time, of course, WhatsApp, etc., Facebook, etc., were still lesser than they are even now. So very little information and no patient support groups, which is when I started this website. I've been devoting myself off and on, and for some time now, almost completely to this over the last 2-3 years. And now we are present on all social media channels. And as I mentioned, we are recognized by the World Stroke Organization, which is the international body for all stroke-related activities, including research, as well as supporting stroke support organizations. I would say a little words about Dr. Anand. You have already said most of it. He's Managing Director, South Delhi Neurology Clinic. He's also Vice Chairman, Department of Neurology at Sir Ganga Hospital, Professor of Neurology at GRIP MER, and has a vast experience of about 31 years in various aspects of neurological disorders, as mentioned by you and as also set out here. And I'm sure, as I said, his contributions over the past so many years, as well as during this webinar, will be very educated. I will just say a little data about stroke and why is it a problem. See, stroke causes either death or disability. Normally, there is nothing in between. The impact is short-term or long-term, depending upon which part of the brain is affected and how quickly it is treated. Globally, now the data indicates that 1 in 4 adults over age of 25 will have a stroke in their lifetime. In fact, this data was about 1 in 6 some years ago. Now it has come to 1 in 4. So the incidence of stroke, because of various factors, lifestyle factors also included, is increasing. It is expected that about 13 odd million people will die worldwide and have their first stroke, and 5.5 million will die consequently. Sorry. It's a leading cause of death and disability globally. Unfortunately, disability is a major concern because approximately 80% of the stroke affected are left with a disability. Now, 2 out of every 3 people who suffer a stroke from a stroke live in low and middle income countries, out of which India is one. Of course, it has got its own constraints, infrastructure, communication abilities, awareness, which is where we come in. As far as awareness is concerned, we are doing a little bit. It is one of the non-communicable diseases. Other diseases are, for example, heart attack, diabetes, etc. And it accounts for more than 62% deaths across India. And in India, it is the 4th leading cause of death and 5th leading cause of disability-adjusted life years. And this is only, generally, as they say, the trend is expected to increase. You have mentioned what causes stroke. Yes, basically, it is supply to the brain is disrupted. Lack of oxygen takes place, brain cells die. Whatever those cells are responsible for is lost either fully or partially. And as we know, brain is almost, as they say, the CPU, pretty much controls everything. So you can imagine the impact on the rest of the body when brain cells die. The disruption can be due to a blood clot, which is known as ischemia, or a burst blood vessel, which causes blood to leak into the brain, which is known as hemorrhage. Ischemia is about 80% responsible for strokes. And every minute an ischemic stroke goes untreated, the brain loses about 1.9 million neurons, 13.8 billion synapses, and about 12 kilometers of axonal fibers. The repair of any of these is more and more difficult as more and more time passes. This is critical because this brings in the time sensitivity aspect of the disease. Normally, a period of about 4.5 hours between the onset of stroke symptoms and start of appropriate treatment, this is termed as time to needle, is considered the maximum for good recovery, after which chances of such recovery is diminished. And recovery is also pretty much just as a matter of adding on. It's a very, I would say, comprehensive process, can take years, some say it lasts a lifetime. Physiotherapy, mental issues, gastrointestinal issues, all those issues come to the fore depending upon what has been damaged. Yet in India, less than 1% reach for a treatment within such time. This is published data. This is a newspaper report and other reports that I'm citing here. So you can imagine the huge gap. The main reason is lack of awareness, because when there is no awareness, of course, everything else drops. And why there is no awareness, also we will address that, and we'll come to that. So as I said, stroke is essentially the problem of awareness. Now, this problem is compounded since many times there is no apparent emergency. Compare this with a heart attack, for example. It is an unfortunate and, of course, a serious disease, but a heart attack cannot be ignored. It is there, it is happening. a layman can make out some emergency has happened. But very frequently, the initial symptoms of stroke are not apparently as serious. For example, one typical symptom is loss of balance. So, okay, one lies down on the bed, maybe take some milk with some turmeric, the symptoms go away after some time. So the person is reassured, that there's nothing wrong, nothing serious wrong. Or it could be a precursor, a pre-indicator of a much more serious stroke going to be happening. This is also compounded by several misconceptions. For example, something, okay, stroke to बूढ़ों की बीमारी है, it appears only to the aged, या जिनको high blood pressure है, या जिनको BP है, diabetes है. Yes, indeed, these are some morbidities, some diseases which raise the increase of stroke, but the fact is that it says it's an equal opportunity disease. It can happen in the womb, it can happen to teenagers, it can happen to athletes, it can happen to weightlifters, and pretty much all of these, as a matter of interest, are also some of them members of our WhatsApp and Telegram groups. People who are physically very fit, martial art practitioners, for example, running own successful businesses, for example, no apparent illness, and suddenly one fine day, stroke occurs. So, very important to recognize the symptoms and then take appropriate actions. I would request Dr. Anand to come in here. These are the basic symptoms of stroke. And Dr. Anand, I would appreciate if you can elaborate upon these. Dr. Anand?
Yeah, sure.
Thank you very much.
Stroke is an emergency. And as has been said, every 2 seconds, we have a patient of stroke on the earth. So it's very, very frequent. Another thing which one should know, 1/3 of the stroke patients are less than 65 years of age. Like it's not now a disease of elderly. It's very often we see patients age of 45, 50, 55. And then another thing to remember is why one has to be fast in treating stroke is you lose 1.9 million neurons every minute. That's hell of a number. And coming to the warning signs, this be fast, we always tell our patients be fast. Remember this synonym. For a neurologist, time is money. For a general public, time is money. For a neurologist, time is brain. So you have to be very fast. Like we talk about time to needle, we talk about time to reaching casualty, we talk about time to reaching CT scan, and like we in the hospitals we have a gray code. As soon as a patient of stroke comes to the casualty, this gray code is activated, and a neurologist, neurosurgeon, interventional neurologist, CT scan doctor, MRI doctor, they are all alert. They know a patient stroke has come. So how does one recognize stroke? A few things which are very important and are very simple. Be fast is for that. B is balance. If somebody feels imbalance, walking difficulty, giddiness, severe vertigo, then it may be stroke. Then eyes. In the eyes, you may have a double vision, you may have loss of vision, the vision may go in one part of your visual field, or you may have a decrease in the vision. Then face, like as Ms. Sodhi has said, when you have a stroke, most of my patients, they say when they had a stroke, a minor stroke, they woke up at 4 o'clock in the morning, they had walking difficulty, and then they will go back and sleep feeling they will get better when they get up, and they land with a major problem. So we have a lot of patients who come up with wake up strokes. So the face is an important indicator of a stroke. You have facial deviation, face goes to one side, you can't drink water, or the water may dribble out of your face. Then weakness of the arm, you are not able to take a cup of tea, or you are not able to button or unbutton, then speech difficulty, like you can't speak, you have dysarthria, that is called dysarthria, or when you speak, it is not very clear. And then T is the time to reach hospital quickly. That's very, that is the most important part of stroke management. We have to have public aware of this need to reach there. Like 1/3 of the patients who reach in time uh, do qualify to be treated with that TPA or the injection, which can change the outcome. And of the 1/3 who qualify, it's not that every patient will qualify. 1/3 will qualify, and of that 1/3, up to half the patients may have a good recovery after they receive that injection. So it is very important to remember the symptoms of stroke, and reach to the hospital, nearby hospital which has stroke treatment facilities as soon as possible. Yeah, Mr. Sodhi.
Indeed. Thank you very much, Dr. Anand. If you could also elaborate, we do talk of stroke-ready hospitals. So what should be the facilities in a stroke-ready hospital? I think that would also be of help here. If you could elaborate upon that also, Dr. Anand.
Yeah, sure. That's very important. Like now, the one thing which all these hospitals should have is a CT scanner. That is because the decision to give TPA or that clot buster mainly depends on a CT or an MRI. Like in a bigger setup like in Gangaram, our protocol is CT or MRI dependent, depending on the condition of the patient, and we follow both the protocols. But for a hospital to treat stroke patient, CT scan is a must, because by doing a CT scan, you can rule out a bleed from the brain, because 20% of the patients who have a stroke may have a bleed, and if you give clot buster, the bleed may increase and the patient may die. So that is one thing. And second thing is, if it is a very big stroke or a very big damage to the brain, then you don't want to give the clot buster, because again, the bleeding chances are much more. And secondarily, they should have a neurology unit. Like so I don't think a small nursing home or a 5 or 10 bedded in locality nursing home will be able to carry out these facilities. So one has to depend on a moderate size hospital, or a bit bigger setup to reach.
Exactly. So understanding which are the stroke-ready hospitals, perhaps in your location, nearer to your area, uh, is also, of course, important. There are apps now slowly emerging in the market, but however, I think it's much more important that generally speaking, one is aware, which are the major hospitals in the vicinity, uh, so that when need be, one can reach over there in time.
So only
Yes,
one thing, like
yes, please.
most of the time, the doctors in that area, the physicians or the general physician with whom a patient must be going for minor illnesses, are the one who are very aware of these. Like, because we have meetings we have monthly meetings with these doctors, and they know which place in the vicinity is running these facilities. So
Okay.
one should contact them, like, and
Yes,
take the
yes.
help.
So exactly. So at that end, at time, whosoever are you at least reasonably in contact with can also offer assistance. Yes, because you are right, Dr. Saab. Yes, and you are in touch, and awareness is also increasing amongst the local populace and even chemists, for that matter. That is something that we are trying to do in our efforts. We are approaching the local chemists also with similar. So thank you very much, Dr. Saab. I'm sure there'll be questions and queries going forward. In case I have time, can I play a small video at this time itself?
Sure.
Shri? Yeah. Okay.
Yes, sir. Please go ahead.
I will just go to the next slide. So these are some of the symptoms. I have some videos here. I will play only one, uh, which is more relevant to our context. It's an actual incident which happened in Delhi. Some of you may recognize that. So when I play it, you will recognize this. So as you can see, this is a very frequently misinterpreted symptom also, as you have just seen an actual event. And I will just take another one, maybe a few seconds to give you another symptom of stroke, which is very frequent. Here it is.
And sensation is happening again. Smile. So tingling on the left side, on the left side. The doctor said to breathe in, breathe out, manage distress. I'm trying. I don't know why this is happening to me. It happened this morning again. And when I left the hospital Monday night at like 12:30 in the morning. So now I'll take the picture for an example of what happens. 6:43.
So as you can see, this is another example of a stroke actually developing. The face is drooping on one side with a slight slurring. So these are some of the symptoms that we pointed out. If okay, maybe we can play this one also. It will give you another.
Now he's been wanting to put garlic chives in everything.
Well, not everything.
These are actual strokes
Dad,
occurring as
Side of
recorded.
your face is drooping. Mom,
Probably nothing.
Dad, are you okay?
You're slurring. Why are you slurring? Raise your arms up in the air for me.
Dad, are you okay?
Gracie, call 911.
I said,
Honey? Tim, Tim, look at me, Gracie. Tell them to hurry. Tim, look at me, Tim. Dad, I think he's having a stroke.
I think my dad is having a stroke.
Tim, what's going on? Cold. Are you cold, honey? Are you cold? Okay. Now he's been wanting to put garlic.
So see, these were some of the actual reasons or some of the actual incidents that I shared with you to give you some idea of the stroke symptoms, the visual indication. I think we can close here for the time. That is us. Thank you very much. I will have, of course, given you website details and, of course, our contact details. Thank you very much. I will stop sharing my screen and we are open to questions from the audience.
Thank you so much, sir. Thank you so much, Mr. Hardeep, sir, for your assistance. You really provided us with valuable facts highlighting the problem of awareness of symptoms of stroke. Thank you so much for the presentation. I would like to thank to Dr. Ish Anand, sir, for illuminating us with your extensive medical knowledge, the need of stroke-ready hospitals, importance of CT scans, MRIs, neurological units in the hospital, and the other treatments. Surely you all are excited to ask your questions to both of our esteemed guest speakers. So one by one, I would request you all to ask your queries by unmuting yourself.
Okay, I'm seeing a question in the chat box with Dr. Ishanand can take. I would request him. It says,
Yeah.
can stroke patients recover fully? That is one. And the other question that I'm seeing, during the initial hours of stroke, what can be done by the people at scene? If you could address that, Dr. Anand.
Yeah, the first question first, like the initial, like we always say, like the ischemic strokes are much more common than the hemorrhagic stroke. And like it is much easier in a patient who has a heart attack. You give them 4 tablets of ecosprin and 2 tablets of atorvastatin. That's what a cardiologist say. You have a chest pain, take ecosprin 4 tablets and 2 tablets of atorvastatin. But in neurology for stroke, uh, it is very difficult to know is it a ischemic stroke or an hemorrhagic stroke. Most of the time, the hemorrhagic stroke patient, they have headaches, they are mostly more sick, and they may be in obtundation of sensorium and may not be able to take much medication. Otherwise, if one is thinking more on the lines of an ischemic stroke, or a patient who has a cardiac illness, or a patient who had ischemic stroke earlier, there is no harm in giving a tablet of ecosprin with a tablet of atorvastatin, say 40 mg of atorvastatin and 75 mg of ecosprin. And these patients should be supported. They should not be allowed to fall. Sometimes you see these patients falling suddenly, or walking and falling and developing fractures, or a head injury. And the other thing is, if it is a sort of a hefty patient, or a patient of somebody who say 100 kg, it's very difficult to transport these patients, and they may develop injuries when they are being transferred. So one has to be very, very careful while transferring these patients. So this is the basic minimum what one can do. And the other thing is, can a stroke but when a patient recover fully? Uh, yeah, like I would say, say if you have a say minor stroke, you have some speech difficulty or some imbalance in the arm, and you reach the hospital in time, and you receive that tissue plasmalogy and activator, and then we have seen patients recovering fully also. But I would say most of the patients, let's say 80% of the patients, will have some deficit. It may be a minor deficit or a major deficit, depending on the site of the stroke and the volume of the brain which has been damaged. So one can say up to 20% of the patient can have full recovery, and 20% of the patients may be bed bound, or not able to live independently, whereas the rest 60% can live independently with some help. And then are strokes hereditary? Like the risk factors for stroke are hypertension, diabetes, elderly, obesity, smoking, alcohol. These are the major risk factors for stroke. But then if you talk about strokes in a younger population, that is called stroke in young, then the causes are different. Stroke in young is a term used for patients who have a stroke who do not have these risk factors, and the age is less than 45. And in these cases, one does come across genetic causes, especially patients who are having hyperhomocystinemia, or patient having, say, some mutation like MTHFR mutation, or a patient having a prothrombin gene mutation. So there are factors which can lead to stroke. The genetic factors are more commonly involved with venous infarction, which is again a different type of stroke than with an arterial infarction. And then the question, how long does it take to recover from a stroke? So it all depends on the volume of the damage, the area of the damage. We say most of the patients, they have good recovery in 3 months after the stroke. And these patients should undergo very good, vigorous rehabilitation program. Recovery from stroke keep happening till 6 months of age, and even up to 1 year. Say if you have to recover, say up to 80%, then you will recover up to 70% in 6 months time, and then the 10% in the next 6 months. And after that, the recovery is very, very slow. So initial 3 months are very important for rehabilitation, for physiotherapy, for speech therapy, for occupational therapy. And that is the main treatment for recovery. The medications will help you recover in the beginning. They will help you to prevent a recurrence, but there's no medicine which can bring back the brain which has been damaged. It is basically the leftover portion of the brain which has not been damaged, because of its plasticity will take over the function of the damaged brain, and then the patient recovers. Okay, then what is the first aid treatment for stroke? I have mentioned about this. The first aid, basically, one definitely need to shift these patients to the hospital nearby. There's not much one can do at home. We need to do a scan to rule out the cause of stroke. In the hospital, definitely when they reach, their BP is checked, the pulse is seen, and then the fever is checked. They're examined like within 2 minutes. Everything is done, and then they are shifted to the scanner. Can you please mention again that what are the different reasons that cause stroke? Yeah. Okay. Like we're talking about the common strokes, and the stroke is a multifactorial. The causes of stroke are multifactorial. Like when I see patients, like the patient who have two or more than two risk factors, they are more likely to have a stroke. And the common risk factors which you see are hypertension and diabetes. Then other risk factors, obesity is a major risk factor. Then elderly, it's a stroke, still it is a disease of elderly, it's seen more often after the age of 55, 60. And then smoking is a risk factor for stroke. It causes atherosclerosis. Alcohol is a risk factor. It can lead to changes in the vessels and can cause atherosclerotic or hemorrhagic strokes. And then the genetic factors, I said it may run in the family. So these are the risk factors. Or what can be done, a person do to reduce his risk of stroke. So it is prevention of the risk factors. Like when a patient has stroke, we discuss all this, what is the cause in that particular patient, and we tell them to control that risk factor. The lifestyle modification, going for a morning walk or joining a gym after recovery, or going on a low fat diet, or control of diabetes with a low sugar diet. All those things are very, very important. I always tell my patients, if they have a minor stroke, like God has just warned you, like you are the one who are more likely to have a bigger stroke. So you have to be very careful. You have not to gain weight, and then you have to be careful with your lifestyle. Like especially too much stress in a patient who has hypertensive, diabetic, and has a stroke is another risk factor for stroke. So you have to take care of your stress also. Can stroke be repetitive? Can the cause be same even after treatment? Yeah, 30% of the patients, they have a re-stroke. And you can't, I always say my patient, you can control your hypertension and diabetes, but you cannot change your age, and you cannot change your family history. So you have the factors, like the age is a major risk factor because it causes atherosclerosis. And most of the time, like the patient who have a stroke, most of the time they will come back more or less with a similar stroke. Sometimes a patient on a blood thinner may have a bleed, like he had an ischemic stroke and then he's on a blood thinner and then he has a hemorrhagic stroke, but that is very, very uncommon. Maybe one in say 1 lakh patient, or not 1 lakh, maybe 10,000 patient may have a bleed because of the blood thinner. But most of the time, they're the similar risk factors like uncontrolled diabetes or uncontrolled hypertension, bad eating habits, and bad hygiene. I would say the sleep hygiene is not very good. These are the risk factors. So it can be repetitive and can be because of the same cause. Stress causes stroke. Okay, stress, I said stress per se will not cause a stroke. But when you are stressed, then a patient who has hypertension, they stress, the BP will suddenly shoot up. And that can give you a stroke. Stress can give you a hemorrhagic stroke if the BP shoots up suddenly, or it can give you an ischemic stroke also. But stress, like I would say, everybody is stressed nowadays. But we do come across patients who have a fight at home, or they were screaming at workers, and then they suddenly had a stroke. But that's not very common, but stress is harmful in a patient who has these factors of stroke. What time of the day most strokes occurs? Yeah, most of the strokes occur in the morning hours of the day, like that is it's called wake up stroke. Every day, like in a hospital, one or two patients will come in the morning around 6 o'clock, 7 o'clock. Okay, they slept well in the night, say 11 o'clock, and then they woke up with a stroke, or they could brush, and after that, when they came back, they were having walking difficulty. And it is the surge of the BP in the morning which causes these strokes most of the time. That is why the blood thinner, the cholesterol lowering medication, and the BP medications are given at night also to control the BP surge which occurs in the morning. Yeah, the young people I have discussed, like it's called stroke in young. Like if you see, say in children, most of the strokes are occur because they have some congenital heart disease, or they have a shunt in the heart, or they have a sickle cell disease. These are the major causes in a younger age group, let's say up to 12 to 18 years of age group. From 18 to 45, most of the time the patient will either have a heart disease, and then let's say rheumatic heart disease, atrial fibrillation, that is the heart is not pumping properly, the rhythm is disturbed, and that the clot can form in the heart and it can go to the brain. That is one of the common causes in India. Otherwise, the other genetic causes I have mentioned, like there are various like anticardiolipin syndrome or antiphospholipid syndromes. These are the one in which there are disturbance in the clotting parameters in the body. How can I change my diet to lower my risk for having stroke? So it has to be a balanced diet. Say if if you are a diabetic, then I tell my patients to avoid taking sweets and sugar, avoid taking rice and potatoes, and then fruits also, very sweet fruits you have to avoid, and consult a good dietitian for good diabetic control. For a neurologist, a good diabetic control is fasting around 100, 110, and PP in the range of 140 to 160, and HbA1c, that is the 3-month sugar, less than 6.5. Why I'm saying this, because most of our patients and the public is aware of these factors, and they know what is HbA1c. It should be less than 6.5 to avoid complication of diabetes. And then if you have a dyslipidemia, then you have to be on or a high cholesterol, you have to be on a diet which is low in fats, like especially avoiding non-vegetarian food, and in the vegetarian also avoiding the milk and milk products, and then taking the medication regularly, going for a walk, avoiding obesity. And the patient who have a hypertension, they have to be on a low fat diet. They have to take salt normally, no extra salt like you put in curd or you put on salad. You should avoid taking extra salt, because that can bring up the blood pressure. But we have seen complication of in patients who have a hypertension, they stop taking salt and they get admitted with hyponatremia or a low salt state, which again is bad. So the person who has hypertension has to take, normally you need 3 to 3.5 grams of salt every day. That is the cooked salt. That is what you take in your diet. And if you have hypertension, you should avoid taking extra salt over and above what is cooked at home. And then how can stroke patients reduce spasticity, stiffness, or tightness of the muscle? Like it's a major issue. Like some amount of stiffness is required for the patient to walk around, to use the limb. If the limb is very frail, very hypotonic, yeah, then you can't stand, you can't put weight on the leg. So some stiffness is definitely required. But if the stiffness is too much, then the maneuverability goes away. Then it becomes difficult to use the limb to move, to work. There are medications also, but physical therapy is one of the treatment options which most of our patients use, and it has good results. But then there are medications available, like the Botox can be given if there's too much of stiffness, and then the Lioresal is another medication which can be given. So there are various medications which can be given to decrease the stiffness. But I still feel physiotherapy is the mainstay to prevent stiffness from happening. Okay, any other question?
Okay, so now I guess all the questions have been answered. Thank you, both of you. Thank you very much. We learned a lot from your extensive knowledge. Okay, now the time has come to end the webinar. I would like to thank Mr. Hardeep Sodhi for joining us today. Your initiative is indeed appreciable, sir. I would like to thank Dr. Ish Anand, sir. Thank you so much for being with us. You are truly very dedicated towards your field, I must say. Thank you all the district members and fellow Rotaractors for your presence. Thank you all for your encouragement, for listening us, and most importantly, for giving us your precious time. Thank you once again, and a very happy Independence Day.
Thank you. Thank you
Thank
very
you.
much. Thank you, Doctor, being here. Thank you.
Thank you.
Wonderful session.